oversee these outpatient clinics, and we're really excited to have them involved.
In the story that Kathy wrote a year ago, you mentioned that there would be a new person added to the board here. Has that person been named yet?
It has.
Okay.
Yes, that's Mark Enger,
Okay.
who is an executive member of the executive management team for OHSU. We added that board seat to our local board. That's a full board appointment, and that appointment is at the discretion of OHSU, so that they selected Mr. Enger. He's a member of our board. He has a boutonniere on tonight because he's actually been seated on the board.
This is a silly question, but I have to ask it. He won't have veto power over anything the board does.
No.
He's just a member of the
He's a member of the governing board.
How big is the board?
The board right now is 7 seats. With the addition of Mark, it will be 8 seats on the hospital board.
Yeah. And again, getting back to, I think, the nature and the fundamental aspect of this, it's one of collaboration. It's not there as a veto or a control element. It's there as a voice to further the communication between both institutions, and again, so that each institution can better understand what the other is bringing to the table. It's a
facilitation. You bet. Yeah, that's what it's looked at.
Any effect on the Plaintree affiliation under this?
Not a bit.
Okay.
Again, as Dr. O'Halloran mentioned, there are just so many benefits that come to both organizations, and I think one of the things that I've had a relationship with Peter. I guess I better clarify that. We've worked together for a lot of years in a healthcare consortium throughout the state of Oregon, and I remember, I know I'll talk a little bit out of school here, but I remember sitting down with Peter over dinner many years ago, and I was kind of drawing out on a napkin where we thought we might be able to take the relationship between the two organizations, and this concept that Dr. O'Halloran articulated about, the community medicine component of the mission of OHSU and our need to strategically align, if you will, with a partner that can help us be all that we can be, just work together so nicely. And one of the things that intrigued OHSU, and as we've gotten to know each other over time, is our philosophy of care, what we do in our community, what Plaintree has meant to us, what we've been able to accomplish as a result of that. And so, no, we'll continue. That is as much a part of us as our DNA. Our philosophy of care, that holistic view of what we do and how we do it, which we are absolutely devoted to evidence-based medicine. OHSU is right in the same wheelhouse as we are in terms of the quality and level of care they provide, and so we're excited about continuing our Plaintree concepts and working with them.
Any chance that some of those concepts would work their way into the OHSU system then?
Well, we would hope many of them are incorporated already,
Yeah.
but absolutely, and we will look not only at the concepts, but how I think they are better applied.
Yeah, and I think Plaintree, if you don't kind of consider Plaintree as sort of an absolute, it's a pathway to get to the same place. I couldn't agree more with Joe. I think there are many of those components, most of those components that are already at play at OHSU. It's just a matter of, we've been able to label that as a Plaintree philosophy we have here, but I think it's different paths leading to exactly the same place.
Cool. I'm going to keep asking you guys. I want to ask Mr. Ross, now the other big players in this system, Legacy and Providence, have networks. Do you see this as the first step in perhaps building closer associations with regional hospitals around the state?
We actually, our intent is to develop a closer relationship with anyone that's willing to work with us. We feel that that's our mandate. It's not just our charge, it's actually a mandate. OHSU is a public institution, it's a statewide institution. We look at our campus as the 96,000 square miles of Oregon. It's not just a campus on Markham Hill. Our strategic plan is actually based upon collaboration, And the goal of that plan is through collaboration, we will do whatever we can to improve the health and well-being of all Oregonians. We can't do that to an equal degree at all places at initially, and that's why we are so excited about this relationship. What we think we can accomplish here, we think will not be only good for this region and the Dalles, but there will be great learning that occurs here that we think will be applicable across the state.
Cool. Let's see.
Anything in this agreement that would prevent you just mentioning you're working with really all hospitals in the state? Anything that would prevent, that will encumber you from certain areas from being able to work with other hospitals?
Not that I'm aware of.
But I know.
No.
Is there a possibility, given the fact that a research institution of great renown, that some research could actually take place here in this facility?
Oh, I think there's not only a possibility, I would think that there's a great hope that that will be the case. And if you look, in fact, at the Night Cancer Challenge that we're involved in right now and the Night Cancer Program that we're developing, there is a statewide element of that. And there's a statewide delivery element to that, and there's a statewide research component to that. And I think this would position Mid-Columbia Medical Center to be one of those entities that would be involved in that effort more quickly.
We're really excited about the expansion and developing. We're proud of what we've been able to do in the area of both medical and radiation oncology, and working with the Night Cancer Center and OHSU to deepen that and broaden it is really exciting to us. And in addition, again, it would be counterproductive to get too deep into the weeds, but that's a big plus for us as well, Roger, that looking at research, training opportunities for staff, training opportunities for future clinicians that come up through the OHSU program specifically, that we can continue to grow and develop here. There are just all sorts of opportunities.
And I'm going to take the opportunity and just pile on here, because if you look at Celilo is already an exceptional community cancer program. So, one of the goals of the Night Cancer Institute is to see how the best cancer care can be delivered in the community setting. Again, we want as much care as possible delivered in the community setting. So this is a wonderful opportunity for us to take not only the expertise, but now the resources that will be able to be brought to bear through the Night Challenge, and invest those here and look at this jointly.
Super. Any capital construction involved as part of this plan?
No.
Okay.
And again, I think what in that realm is, as you know, we have a desire, we have a need for the replacement of our patient tower. You and I have talked about it before, Roger. We think this relationship is essential for MCMC meeting our own goals of being able to accomplish that goal of that kind of an investment of capital. There are certainly resources that OHSU is devoting to this relationship. It's a mutually beneficial relationship, but there is no capital investment on their part or commitment to do so in terms of bricks and mortar.
But perhaps the association will draw other funders.
There, well, and also it allows us, again, I mentioned before, it's not really sexy, but the pressures that are coming to bear on healthcare today in terms of shrinking dollars being able to be devoted for healthcare, and we understand that we have a delivery system crisis in our nation today, where we have a healthcare system that its citizens can't afford. So we've got to become more efficient, but the ability to do that and generate enough reserves from what it is we do each and every day to be able to replace a physical plant becomes more feasible, much more feasible in our opinion, because we have relationships like this than if we were going it alone.
Sweet.
Roger, if I could just circle back for 1 second about your question about research.